Well, more Ontarians could soon be able to get a fourth shot of the COVID-19 vaccine.
That's right. The province's Chief Medical Officer of Health, Dr. Kieran Moore, is set to make an announcement on expanding access to a second booster dose. Right now, only certain at-risk groups and those over 60 years old can get a fourth shot. Dr. Moore is also expected to provide an update on the rapid antigen test program.
And for more on this, we're joined live by CBC4 Chanel Call. So, Chanel, we're about 3.5 hours away from this announcement.
That's right, Jen and Bakari. We're waiting to hear more about this from the province's top doctor, Dr. Kieran Moore. This will happen live at 11 o'clock. We'll carry this for you, of course, on CP24. For more, I want to bring in Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital. Good morning, Dr. Grill. Thanks so much for making time.
My pleasure. Good morning.
So I just want to start with asking you what you're hoping to hear from the province today when it comes to the rollout of fourth doses here in Ontario.
What I think we're going to hear, based on some media reports and what I've been reading, is that the Chief Medical Officer of Health is going to open up fourth COVID-19 booster doses to those aged 18 to 59. There might be an emphasis on certain groups within that age range, like essential workers and healthcare workers, just given the staffing challenges in those industries. I also think it's an opportunity to remind everybody that third doses are very, very important when it comes to COVID-19 vaccination. I mean, 2 doses have shown to protect you against severe disease, but 3 doses are significantly better to prevent you from getting a severe case of COVID-19 and ending up in hospital. And, third doses have been pretty good in people 60 and over, and those populations that we're really worried about in terms of, healthcare risk. It's over 80% in people over age 70. But there's still significant amount of people 18 to 59 who haven't gotten their third dose. So again, it's a really good reminder for everybody to get caught up.
So, Doctor, if the majority of cases that we're seeing right now in Ontario are Omicron, some of these more new, dangerous variants, how effective are the existing booster shots in fighting those newer variants?
So we do have data, real world data, to show that if you have, third doses and even fourth doses for those that have been eligible, it has still worked against the Omicron variant, including BA.5 so far, which is, what's affecting this current wave in Ontario. We're not, the majority of people that are getting severe cases are not the ones that have had third and fourth doses. It's protecting people significantly well. And so it's still holding up. I think the data out of Israel showed that for people that are older and the ones we're worried about the most with, chronic health conditions and including immunocompromised, getting a fourth dose actually has lasting immunity against severe illness, including Omicron. For younger people, it's a little bit different. Their antibody levels go up and they stay up, but only for a few weeks. And so, the same effect on young people versus old isn't the same. But it's still going to provide some extra protection against Omicron, which is what we need right now during this wave.
And we're also hearing from, other doctors who are looking ahead and hoping that there might be a newer vaccine that would better target variants like Omicron. How far away are we from that scenario?
So we've heard that there are vaccines that are, in the process of being developed, bivalent vaccines. So these vaccines target both the old strain of COVID-19, so the original strain that we were dealing with even back as far as 2020, and they're also targeting the Omicron strain, which is the current sort of subvariant that's affecting the world globally. Not sure when these will be available. The prediction is they'll probably be available in the fall. They still have to go through approval by Health Canada. We'll definitely hear more from the National Advisory Committee on Immunization once those are ready. And I think it's something we can look forward to because we do want a new vaccine to target the Omicron variant. Our vaccine right now, again, was still not designed to target Omicron. It is still working, again, more on the severe cases, but I think we're all looking forward to having an opportunity to get a new vaccine come the fall.
Okay, thanks so much for your insight and your time this morning, Dr. Alan Grill. We so appreciate this.
My pleasure. Stay safe.
Thanks, you too. Have a great day. And so this announcement from the province set to happen at 11 o'clock here at Queen's Park. Jen and Bakari. There's also another announcement happening at 12:30 today with Toronto's top doctor and Toronto's mayor. They will be discussing Toronto's plan for fourth doses. Back to you.
Okay, a lot of health announcements to look forward to. Thank you, Chanel.